You would not believe what we had to do this year to hit our clinic goals. So if you attended the MyVitals Pro webinar back in February, then you know that the amount of new patient scheduling appointments this year was dramatically down from historical averages. Basically, the entire hearing aid industry was off to a really bad start. However, one of the things that stuck in my head from the MVP webinar is that the best performing clinics in the MVP data set were the ones who were able to leverage their existing patients rather than having to rely on new patients coming in the door. Now, we had just come off of 2024 with our biggest year yet with over 30% growth, but after the first quarter of 2025, we're basically looking at our numbers saying that we're screwed. But since we were aware of the problem and we knew the numbers that we had to hit to reach our goals for 2025, we were able to develop a plan for the rest of the year. First, we focused on upgrading new patients. New technology was released at the end of 2024. This gave us a reason to tell our patient base that we had something better that they needed to try. So we developed an upgrade program where patients could be fit with the new technology, pay for a new technology fitting, so even if they chose not to upgrade their technology, we still took a step forwards with our revenue goals. Second, we focused more on training our staff to ensure that our provider conversion rates were as high as humanly possible. If you have less new patients scheduling, you had better be really freaking good at converting them into treatment. And I'm extremely happy to say that our providers are now the most effective that they have ever been, increasing their conversion rates by up to 10%, which is massive. Being a private pay only clinic and having conversion rates between 80 and 90% is a game changer and makes us less reliant on a massive influx of new patients. Basically, we focused on quality over quantity. And third, we virtually lived inside of our MyVitals Pro portal to see where we were trending throughout the year. Using MVP's pipeline feature, we're basically able to predict the future in the clinic based on current trends, and their goal setting feature, which is my personal favorite feature, always helps us understand where our clinic is at and if we need to buckle down even more. After all, what gets measured gets improved, right? Now, I'm happy to say that we did hit our revenue goal this year, but just barely. But you know what? Given how the year started, I'll freaking take it. Now, if you'll excuse me, I've got some work to do if we're gonna hit our goals for 2026. But if you would like to check out MyVitals Pro to see how they can help make sense of your clinic data so you can take actionable steps to improve your clinic, just click on the link in the description.